Hello, we'll be speaking with Dr. Michael Dixon here at the University of Manchester. He is the one who first discovered the gene for Treacher Collins syndrome, TCOF1, in the early 1990s. And I am Dr. Francis Smith from the University of Colorado. And the purpose of our interview today is to inform and educate the public about the rare craniofacial disorder, Treacher Collins syndrome, and how it develops during embryonic development, and how our research can help prevent and treat children with this disorder. First of all, please introduce yourself to us.
Hi Francis, so as you've said, my name is Mike Dixon. I'm the Professor of Dental Genetics and a researcher in craniofacial biology here at the University of Manchester in the United Kingdom.
Why did you become interested in research into Treacher Collins syndrome?
Well, that's an interesting story, Francis. So my training's originally in dentistry, although I no longer do any clinical work. And whilst I was in training, I was fortunate enough to go to a maxillofacial unit close to the city centre in Manchester. And the first patient I saw there actually had Treacher Collins syndrome. And as you've said, that's a rare condition, so that was an unusual situation for me to be in. And strangely enough, the consultant who was leading the clinic asked the students there if they knew what the condition was, and just from some of my reading, I knew indeed that this was Treacher Collins syndrome. So that was my first meeting with a patient who had Treacher Collins syndrome, and I like to think that that was the thing that pushed me on this path. So that's a great question, thank you.
Thank you very much. What can you describe to us what is Treacher Collins syndrome and what are its effects, and are they variable?
Yeah, of course I can. So Treacher Collins syndrome is a congenital condition. That means that the person who has Treacher Collins syndrome is actually born with the condition, and it doesn't particularly get any worse thereafter. So you will typically recognise a patient who has Treacher Collins syndrome by a number of features, and that's why it's called a syndrome. So usually the eye sockets slope downwards from the nose towards the ears, which is not the usual way in which the eyes are positioned. The cheekbones are underdeveloped, and so is the lower jaw, the mandible. And what you often see because of that is a cleft of the palate. In addition, patients have problems with the outer ear and also the middle ear, which can be very narrowed. And this can lead to a conductive hearing loss. So what that means is the sound waves can't get through to the inner ear so that patients can hear. And those are the main features of Treacher Collins syndrome. In general, we don't see any other features, so it's solely limited to the so-called craniofacial complex. But as you've highlighted, it's very variable in the way in which it's expressed. In other words, you may see a patient who's very severely affected, but also at the other end of the spectrum, you may see somebody who is so mildly affected, it's very hard to say that they have Treacher Collins syndrome clinically. That we call variable expression, and actually it can occur within a family as well as between families. So those are the features that constitute Treacher Collins syndrome.
Can you tell us now what causes the syndrome? Is it mainly genetic, and are there other factors responsible?
Okay, yes, so it is a genetic condition. It's usually, but not always, inherited in an autosomal dominant fashion. So what that means is that you will usually have one or other, but not both parents, who also have Treacher Collins syndrome, and then it can be passed down equally from mother or father to sons or daughters. So the vast majority of Treacher Collins syndrome is inherited in that way, and in most cases, as you mentioned right in your very nice introduction, are due to mutations in a gene that's called TCOF1. And that was, as again you highlighted, a discovery made in the mid-1990s, about 1995. Since then, we have found that mutations in two other genes, called POLR1C and POLR1D, also cause Treacher Collins syndrome. But mutations or breaks in those genes are very, very much rarer than they are in TCOF1. And then to answer the second part of your question, although there must be other factors at play, because as we highlighted earlier, it's a condition that's very variable in its expression, we don't know other factors that specifically cause Treacher Collins syndrome.
And how and when did you discover the gene TCOF1?
So it was, as we mentioned a moment ago, discovered in 1995 here in Manchester, and it was a collaborative effort between our own research group and the group of the late Professor John Wasmuth at the University of California in Irvine. More recently, the other two genes were discovered by a collaborative effort between our group and groups in the Netherlands and in Germany, and that was much more recent. That was in 2011.
When the TCS gene is faulty, how does the mutation affect facial development? So, by that I mean mostly in TCOF1, but also in the POLR1C and V.
Okay, so most of the things that we know now in terms of how the gene and the protein operate are discoveries made using animal models, but we assume that the same thing happens in human development as well. So the gene TCOF1 encodes a protein that is important for making little protein production factories called ribosomes. That's TCOF1's function, and actually it also happens to be the function of the two other genes, POLR1D and POLR1C. And what we are confident then happens is that the lack of these proteins means that we don't get sufficient production of these little protein producing factories, the ribosomes, and a particular population of cells that are important for facial development, called neural crest cells, don't form well because they die before they have the chance to be involved in facial development. So we end up with this complex series of events where the gene breaks, it doesn't allow production of a protein involved in ribosome biogenesis, and as a result of that, a population of cells dies, and there are not enough of them for facial development.
What do you consider your most important finding?
Well, I think all research into Treacher Collins syndrome is important, so it's not that we find, one thing's more important than another. But if I had to sort of pick one thing out, I think finding the TCOF1 mutations was a really great moment for us, and I hope actually also for families. So why do I say that? Well, from a scientific challenge, it was really a big challenge at the time, because the way that we do things now and the way that we did things then has changed a huge amount, and it's very much easier now to find genetic mutations than it was in the mid-1990s. So it did take a long time. It did require fantastic input from a huge number of dedicated patients and families. But ultimately, by working together, we were able to pinpoint the mutations that cause the TCS.
What do you find are the scientific and other challenges facing our research, you as researchers for TCS in making further advances?
Okay, I think probably if you ask any researcher that, no matter what they're working on, they'll come back with a very similar answer. And of course, we can't do this sort of research without funding from either the US government or the UK government or fantastic charities that support the work. So clearly one of the challenges is having enough time, money to pursue the research. After that, picking out individual research questions, of course, then what is the next question? And of course, for this, it's always difficult to pinpoint, but understanding the way in which, even with the same genetic break, the same genetic mutation, you can end up with severely or mildly affected people. That's a very interesting challenge. Why do we see this variability in expression? And further research then into how we can prevent Treacher Collins syndrome is, of course, a massive challenge, but it's a challenge that the field is prepared for.
Thank you for your comments on that. I'm also finding potential for the use of quantitative geometric morphometrics as a potential diagnostic tool, especially for hard to diagnose cases in TCS, as well as for determining potentially how genetic variability can affect morphological variability in TCS. And more recently, working with other researchers, we find that the use of upper airway volume measurement by a technique called volumetrics from the CT scans also helps us determine how the syndrome affects the airway by narrowing it.
I think actually you're right. These are really important questions, and what we always need to make sure of as researchers and clinicians is that we're answering the questions that patients want us to answer. That's really important. So I think the things that you've highlighted there are really important research questions and will help patients and families in a number of very positive ways.
Where do you see breakthroughs occurring in TCS research in the future?
So I can really only comment scientifically because obviously there's a lot of really exciting work in the treatment of patients who have Treacher Collins syndrome, and that's not my area of expertise. But I think breakthroughs are likely to come in the next few years in really understanding this variable expression. I think that's an important one. And possibly in the longer term, in looking at ways in which we could potentially prevent Treacher Collins syndrome. It's been done in mice, and there's some nice work from Paul Trainer's group that shows that antioxidant supplementation can really help in this area. Whether or not we could apply that to humans is an open question at this point. But I think those are the two main areas that people will be looking to advance in the laboratory.
I have to agree with that. You are mainly involved in basic research, is that right?
That's absolutely right. Despite my background in dentistry, I've really moved over to understanding, or trying to understand, craniofacial developments in terms of Treacher Collins syndrome and also in other conditions too.
Okay. And you have any interaction with clinicians in treating children with this condition?
Yeah, absolutely. I mean, we have strong ties with the Treacher Collins Family Support Group in the UK and also the similar foundation in the United States. In terms of clinicians, yes, we do interact with clinicians, and particularly this was an important element of being successful in finding mutations, specifically in TCF1. And I'd really like to emphasise, actually, at this point, that it absolutely is a partnership if you want to make research advances between basic scientists, clinicians, scientists, and patients and families. If that group of people work together, you are far more likely to be successful than if you try to work in isolation.
I have to agree with that. I want to foster more of the three-way interaction between us researchers, clinicians, and the patients and families.
Yes, and actually the Treacher Collins Syndrome Foundation had a meeting after a scientific meeting in Ohio, in Cincinnati, last year. It was unfortunate that I couldn't stay on for that, but I had to get back. But I know that you were very active in meeting with the families, and Paul Traynor was also able to meet with the families, and I think that's so important.
I think it's also important to reach out to the public and educate them.
Yeah, again, that's another really important point, Francis, actually. This, not just with the Treacher Collins syndrome community, but also with the wider community of patients and the general public who may not have these conditions. I think deepening understanding and empathy between those communities is really, really important.
How do you feel that research and clinical treatment of Treacher Collins could be better integrated?
Yeah, that's an interesting question, and you can't force collaboration. People have got to be willing to work together. So I actually think that videos like this will be helpful in that regard. So I mean, I really welcome the work that you're doing in this area. Yeah, we could integrate better. The difficulty often comes down to time, so we've got to make time and space available for people to pursue those interactions. And again, scientific meetings where you have patients and clinicians and scientists together in the same room for a period of time, away from their day jobs, away from the things that they do in their personal life, is a really good way to foster those kind of interactions.
What are the current treatments and therapies for children affected, and how effective are they?
Okay, so I can't really speak in a lot of detail about the clinical side of things, but obviously we integrate teams, multidisciplinary teams, so that surgeons, otorhinolaryngologists, dentists, orthodontists, speech therapists work together. That's really important, and I think we do get fantastic results, and the advances that have been made in bone-anchored hearing aid have been superb. Genetically, well, what we can do there is if we've got patients who are hard to diagnose, we're not sure whether or not they're affected, of course we can apply a genetic test to help complement the clinical diagnosis, but in that arena the first area is always a clinical diagnosis. The genetic diagnosis is really secondary to making sure that you examine patients carefully. So I think there's lots of reasons to be optimistic for patients with Treacher Collins syndrome, and I think in general we get some fantastic results for patients and families.
In my own lifetime, I have seen advances in mandibular and maxillary surgery, making it less traumatic. With the older paradigm of orthodontic surgery, meaning harvested roots as grafts for the jaws, and being sometimes supplanted, but also often supplemented by distraction osteogenesis, a process of slowly drawing the jaw forward with, after cutting the bone.
Yeah, I agree with you. I mean, that's not one of the things that I highlighted, mainly because it's not something we've been involved with, but I am aware of the fantastic advances that there have been in distraction.
Besides the medical issues, what are the other important issues to be addressed in Treacher Collins syndrome, including psychological and social effects?
I think, yeah, these are important issues, and we have to treat the whole patient. So it is important to take account of psychological effects of Treacher Collins syndrome, and indeed any condition that affects craniofacial development. And I think that I hope this kind of video helps people to see that actually they're not on their own, that there is a community out there that hopes to support patients, families, and indeed the wider public. So I think we do have to pay a lot of attention to other elements and not just treat a condition. We need to treat a patient and their family.
I have to agree with that, because the patients face the social attitudes centered around the face, and children especially have it hard in school with bullying.
Yeah, absolutely. I couldn't agree more with that. And hopefully books such as Wonder, your own book, really help to break down some of those barriers. And I know that in the UK at least, that in Year 6, and we were talking before about the fact that you've been presenting some of your work to Year 6 children, that actually they do study the book Wonder as part of the curriculum. And I think that's so important. Again, not just for Treacher Collins syndrome, which the book's centred around, but also more generally for people understanding the challenges faced by individuals with facial difference.
In future, what advances is foreseen in prevention and treatment of Treacher Collins syndrome?
So I think we highlighted earlier on that one possibility for prevention is the work that's emerged from the study of animal models, and that's around antioxidants. That's something that could be potentially exciting in the future, but the time frame inevitably with these things is long, but maybe one to keep an eye on. In terms of surgery, I think there are people better placed to comment on that than me, so I'm going to let that one go if you don't mind.
Okay. And I want to thank you, Dr. Dixon, for speaking with me, and it's been a very highlighting and informative discussion that we've had.
Well, thank you, Francis. I really appreciate the opportunity, and I really hope that the discussion we've had today is going to be useful to people. I hope so. Thank you.
Thank you.